Next talk is by Dr. Gagan Bhatia, Speed with Efficiency, New Generation Cutters.
So good afternoon, everyone. I'm sure by now all our Ang2 levels are upregulated. So let's talk about some surgical parts. So speed with efficiency, new generation cutters. In this, I think few slides have been given to me by Alcon. So where we started with this Machammer's MIVS design, which was a big cutter with fluidics also included in the cutter, and then from there we moved to smaller gauge, from 20 gauge to 23 to 25. I think we all would have seen the transition from 20 to 25 gauge cutters. So vitrectomy probes basically evolved through the time, and one of the biggest evolution was the twin duty cycle cutter, which cuts in the pro and the con phase. So with this, I think with newer cutters coming in, I think even our wish list kind of improved, and we started designing stable IOPs, which basically means controlled ingress and egress of the fluid, stable and efficient tissue response, so basically lesser pulsability, which basically means that when you go very close with the cutter, lesser movement of the tissue that happens. And also minimal traction, which is basically required, and very controlled vacuum, which was the desired list. So with the traditional cutters and with newer cutting, with thinner cutters coming in, I think the concerns were decreased vitreous flow, because obviously you have a lesser bore size, then increased surgical time, increased post-close time, and unwanted flexibility. We all remember that once the 27 gauge cutters had come in, initially they used to break. At least for me, they used to break a lot. So, but nowadays the newer generation cutters seem to have tackled all those problems. So as I said earlier, one of the biggest inventions in cutter technology was the twin blade cutter, or the TDC cutters. So this was something which Doc has initially stated that, so there is a cut which happens when the cutter probe moves in and out. So you're basically doubling the cutting rate. And if you see this video, you also see that seems to be very good flow that happens with the TDC cutter. So with this technology being introduced, there were studies that were done in literature, which I kind of went through, and they basically say that in this simulation model, with increased cut rate, with the TDC cutters, these had increased flowability with water, and as well as in egg white, which kind of simulated vitreous, there was better flowability or flow rate with a TDC or a dual cut mechanism. So probably the dual cut mechanism improves the duty cycle with the cutter port more open at more times. So that is when Alcon came up with Hyperwit. Hyperwit is the new 20,000 cut per rate cutter with a continuously open port, which has a dual pneumatic drive and a bevel tip design. So how this helps? So it gives better efficiency. So if you see here, the difference between this cutter and the TDC cutter is that the TDC cutter, so the TDC cutter basically has, so the TDC cutter basically, when it goes out, it is active, but when it comes back, it is passive. But in this cutter, the good thing is that the going in and out phase, both is an active phase. Secondly, there is lesser traction because it kind of breaks the pieces into smaller fragments, and the bevel design basically helps us to go very, very close to the retina. So probably good to say that this has improved fluidic stability, which has improved efficiency, and also surgical versatility is there. Now, to prove all these points, I went through the literature, and as David et Steele in the study basically said that as you increase the vacuum, the flow rate increases. That's pretty obvious. But then what is more important to see over here is that with the Hyperwit, which is a 20,000 cut rate cutter, and the Ultrawit, which is a 10,000 cut rate cutter, the 20,000 cutter has better flow rate when we just study it as a design for cut rate. So with increased cut rate, ideally you should have lesser flow rate, but with Hyperwit, you seem to have better flow rate, probably because of the dual cut design or a better duty cycle. Coming to tissue traction, again, the Hyperwit, which is a 20,000 cutter, has lesser tissue traction in studies, and And also if you go to this vacuum simulation model, so basically what I learned from this was that you need lesser vacuum to achieve the same flow rate with the hyperwit or the 20,000 cutter. So probably, many times when we have used the 20,000 cutter, if you go with the same vacuum settings, you do see a little bit of pulsatility. So which kind of decreases when you decrease the vacuum, because you achieve a good flow rate with lesser vacuum, making the surgery way more safer. So when we come to pulsatile motion again, the bevel design, how it helps is as you go very close to the retina, the surface of influence, so basically the amount of retina that it kind of catches is much lesser with the bevel design. So I think it would be safer to conclude that it is the newer cutter is more efficient, so because of increased flow rate, high cut rate and better duty cycle, and with hyperwit being a dual active mechanism, maybe it probably gives almost 100% duty cycle to us. As far as safety is concerned, there is definitely reduced traction on the retina. It is smaller vitreous fragmentation, so basically because it's cutting very fast, so there are lesser, the fragment that you're pulling in is very small, and that is why the pulsatility is very less, and safer maneuverability is obviously there. So thank you.
Gagan, just one question. I've been using these 20K cutters since its launch in India. So my parameters are 400 suction for the core vitrectomy and 100 for the peripheral shaving part. Is there any difference in your settings or the same?
Yeah, mine would be for core.
For a RD case, not attached retina.
No. So in an attached retina, right? So
no,
in an detached retina, I think core would be around 250 to 300, and for shave mode, I keep it around 150. 150. Yeah, with the 20,000 cut rate. Initially, I was keeping it to same. I was keeping at 300 and 250. So the core was at 300 and the shave mode was at 250. But what I've kind of realized with these higher generation cutter is that because the duty cycle doesn't change during the modes, it's almost the same. So you probably with depending on the type of detachment and the amount of fluid, probably I think a safer limit of roughly around 200 is okay with these 20,000 cut cutter.
So have you?
Please.
Have you experienced any change in reflux in between 10K and 20K cutters?
Yeah, definitely. So that is what I'm saying, that with the 20,000 cutter, really those 3 cycles don't really matter too much. I think the core and the shave is almost the same. Whereas in 10,000 you will find a big difference between the two.
I'm talking about the reflex action, what it gives with the cutter.
No.
It doesn't matter.
No, that doesn't matter.
With the 20K, is there any difference with the 10K?
With 20 gauge?
Yeah, with the 20K cutter.
No, I think it's pretty much the same. I don't think it's really different. What it probably is just made the shaving a little more safer. So the higher cut rate. Probably from 7,500 cut to 20,000 cut there is a difference. So that ultra width, the 10,000 cut rate is I don't think much of difference. But yeah, definitely the 751 and this, there is a difference there.
What about the proprioceptive feedback? Like in the sense that do you feel that from 10K to 20K there is more vibration or anything like that?
Slightly.
Is that an impediment sometimes, when you're doing shaving of like diabetic membranes or something?
Sir, I just again, I do feel that if you reduce the vacuum, that reduces a bit.
Okay, but it is a factor.
It is a factor. It is not that it is not a factor.
Because we saw that when we moved to 10K, everyone noticed that, there was more of a, little bit of a vibration that you feel.
There. That slightly is there.
Yes.
Yeah.
So I haven't experienced.
Which I feel is that firstly they have discontinued the 23 with the 20K cutters. So you cannot do a 23 gauge surgery. So sometimes in difficult cases I would like to do a 23 gauge surgery, but now I have to do 100% cases of 25 gauge.
Oh, they don't have 23?
They don't have 23 gauge with 20K.
Yeah.
And the second thing is you cannot reuse it as many times as you could use a 10K cutter. So the life has gone a little bit. Yeah. So we all reuse, and that's a little,
For some
and
reason,
the pack is a little more expensive than the 10K.
Yeah, and you have to buy packs of six. Yeah. But I think it goes through for all the instruments. The reusability has gone down for, I think, all the instruments.
Yeah, it has gone down.
In the past couple of years, I feel it has gone down. Yeah.
And even I think coming to Vishal's question, I think I don't think that at least in my this thing I would really define a 23 or 25 gauge based on the cut rate. I mean, I think if I have to do a 23 gauge, I'll go for a 23 gauge, whatever might be the cut rate. So I think that should not be impediment, but
then
yeah.
you see the practicality is that you have to buy 6 23K packs and 6 25K packs, and that is not feasible
Not
for every
feasible.
setup. That's
Yeah,
what I'm trying to
exactly.
tell you.
So besides that, for vitreous hemorrhage, like it is a long-standing vitreous hemorrhage, have you used higher vacuums to 600 ever?
Yeah.
And do you say 23 gauge cutters are more stable than 25 gauge with that much of vacuum?
No, 23 gauge cutter will have a more followability, so you just increase your bottle height a little bit more than what it was, what you generally keep.
Take the bottle out.
But it's just, yeah, I mean, because nowadays most of the machine have active infusion. So if you're using active infusion, it kind of compensates most of the time. So I don't think it really matters. I think it's whatever works best in your hand and how, confident or how versatile you are with that, with your own machine. So I think vacuum is probably not this thing. So as Vishal also said, I think we all use almost the same amount of vacuum. But yeah, increasing the vacuum really doesn't matter if you're doing core per se. Thank you, sir.
Thank you.